My name's Nikki. I'm a registered nurse in peritoneal dialysis, and I've worked here for 10 years.
My name's Kelti. I'm also a registered nurse in the peritoneal dialysis program, and I have been a nurse here for 4 years.
One story that comes to mind for us is we have this patient who was very young, came in acute to hospital and found out he was in kidney failure. He was going to be going for the procedure to get the peritoneal catheter put in right away, and we had to give him education to him and his family 20 minutes before going under the knife. It was overwhelming, and he was very overwhelmed, had no knowledge of kidney failure, kidney disease, and from there he was with us for a good couple of months where he was in hospital. We started dialysis right away, and he is a success story now. He's been with us for about 4 years, and he's at home doing his own dialysis, on the transplant list.
It's just amazing to see how once they're out of hospital and back home and they're integrated back into their everyday life, how much it really does change their life. And it's very successful for us to see them back in their follow-up appointments doing well and healthy.
I feel like it was all education and the information and making them feel comfortable that we're their team. Like, it's not just us, the nurses, it's the doctors, the nurses, the social workers, dietitians, even our clerks, pharmacy. If they have questions at home, if they run into problems, they can call us. And we tell them, anytime something happens, please call the unit. Like, we're here from 7 in the morning till 11 p.m. And he does, and he's such a great patient, and he becomes one of those, like, you see him often where he's comfortable and he can tell us anything, and you have a good relationship.
I think it's really just, the support that we do provide to our patients, even remotely from a distance. It's really amazing to see how much our program has adapted as well to providing patient care.
Anyone who makes it home is a success story, really.
Yeah. Right.
They want it. They don't want to be somewhere where it doesn't feel like home, doing away from their family, doing a medical procedure. And that's what they're really doing every day when they're at home. So
I think a big part of our program too is we have the opportunity to do home visits up in the northern communities. So we're actually able to go into these communities and, be a part of these patients' lives and see, really how their communities and their culture rallies around them to make them also successful at home.
Our peritoneal dialysis program takes care of patients from the Manitoba border all the way to White River and up to Hudson Bay. So when we take care of patients, we're taking care of them all through the region and then trying to get them back home. So it's long distance, it's lots of travel, lots of planning. And I mean, we just had a couple nurses go all the way up to Kanjicum and see the facilities and check on the patients that are there. And that was a neat experience.